At its heart, this business is a people business. How do you approach the recruitment and retention of your people?
Our staff are the basis of our business. So, and for us to look after our staff is so important. So, the growth of the company has been so rapid, and our recruitment has had to support that. So, we have a really good human resources department, but most importantly, it's about recruiting staff, but it's also about retaining the staff. So, we have our own training academy, which we use for all our mandatory training. We have Learning Pool, which is online access for training. So it's very accessible for all staff. They can do some of it at home, they can do some of it in work, and we also have a site on the Boucher Road. I think from our point of view, we look at the people that we have, and we can see the qualities in those staff, and then we look at developing those staff. I'm an example of that. I started here as an outpatient nurse 12 years ago and worked in outpatients for over 11 years, and I'm now the general manager of one of the hospitals.
Anthony, do you think that customers are more aware these days of proactive healthcare, if we could call it that?
So Kingsbridge, over the years, we were the first private healthcare group to bring in private GP services. So we know now that patients are struggling to see their own GP. The younger population and the older population are more aware of their healthcare needs at this point. So we want to encourage that proactive healthcare. We offer quite a few screening services through our own GP service or diagnostic centre in Kings Hall for colonoscopies and scopes. So those procedures allow patients to come, have their diagnosis and make sure that they're A-OK and up to date with their own health screening. We offer that same services to our corporate members as well, so we have quite a lot of corporate partnerships, and that helps keep their employees and their workforce back in work and healthy. So through our GP and Kingsbridge membership club, those patients come to us for their health checks, their screenings, and we can go on site as well to those corporate partners and do health screening with them as well.
One of the key selling points, if you like, of private healthcare is speed of access. How has that changed? How has that developed?
I think it's always been something in the private world, is the appearance of immediate access to care, and it's still there with us. We have expanded all the different types of services that we provide, and that might not necessarily be surgical things. We're talking about outpatient appointments, dermatology, the different specialities where surgery doesn't get generated but long-term care is required. Patients can self-refer into many of those. They don't need to see a GP beforehand, and the consultants will see them very quickly, sometimes within a day or two, sometimes in a couple of weeks, depending on what the speciality is. When we acquired the North West, we had to look at the demographics of where patients lived and what we could access for them and how we flex that across the group. So you can have a consultation in Ballykelly, you can come down and have your surgery down in Belfast if that's where you need it, and you can go back up close to home if that's where you're from and have your review appointments. You can go and see the nurses there to get post-operative care done, and that works the other way. So it allows particularly Anthony and I to be able to cross-site the patients and suit what they need and to reduce the travel time for them. Whereas before it used to always be Belfast because that's where we were. While we've got North West, it's not that we can do everything at both sites, but we do try to, but we can certainly patients centralise what they need to get the best benefit for them.
Jennifer, tell us a bit more about the development of the Sligo site and your plans for the future.
So over recent years, Kingsbridge Group have invested quite heavily in partnership with Alliance Medical as well. We have increased specialities in our hospital and complexity, and we have also brought in an MRI scanner and X-ray on site. Going forward, however, we have planning permission for a brand new surgical grade hospital and an imaging centre on the same site, which will provide the west coast of Ireland with more complex specialities, including orthopaedic surgeries.
Mark, the Kingsbridge growth story, if you like, has been a phenomenal one. Tell us a bit more about where this group has come from and where it's going to.
Well, I was reflecting this morning on the article that we done in Business Eye back in 2011, in the very early days, just a few months after we had opened, with Ash and Suresh, our two founders, in the background of a room that isn't even in the hospital. Like all too often, very few of the rooms that are in the early days are still there. It constantly evolves. And back in those days, that was 5 years after I'd started the company with Ash and Suresh, but private healthcare was still something that was seen as a special club, or those who had bupa, inverted commas, as I normally described, and so much of the population didn't really understand what it was, a bit of mysticism around it. That's changed totally now in the last decade. I think now it's mainstream. It's part of the fabric of the healthcare ecosystem, not just in Northern Ireland, but also across the whole island. We were looking last week at some work we were doing around where our patients come from, and we put up a dotted map with a dot in every town or village, and it literally is every county in the country has a dot with Kingsbridge patients have come to it through the cross-border directive, where they come and 200-300 every month, so somewhere around about 2,000 bed nights will be occupied in hotels across the city, both here and in Kingsbridge North West, but also others coming for more elective procedures and medical tourism, and of course the local growth of people who are just simply not willing to wait 5 or 6 years for treatment in the public system and are taking control of their own health, becoming empowered, deciding not to go on holiday, not to change the car, but spend that either on their own healthcare or a family relative's healthcare.
Now, this has been a story through the years of sustained investment by the company. Will this investment go on?
It will, undoubtedly. It's something that we have to do, and it's something we're very proud that we've done. That yes, it is a business, and yes, business does pay dividends, but all too often those dividends are going straight back in to expand the offering that we have. A decade ago, we were one hospital here in South Belfast. We're now in Sligo, we're now in Kingsbridge North West. We've now KDTC, the Kingsbridge Diagnostic Centre, across the road from here. So those 4 main hospitals or registered hospitals we have at the minute, that undoubtedly will come more as we move forward with all of this with reinvestment.
What comes through from everyone I speak to in this organisation is that fundamentally this is a people business. How do you keep those people on board? How do you keep them engaged?
Well, we've over 1,000 employees now within the group, right across from administration, medical, nursing, radiographers, physios, and I'll stop there because I'm sure there's another 20 I'll leave out and upset someone. But that whole healthcare family that we have within Kingsbridge, I'm constantly asked, how do you keep them? How do you attract more in? And I say the one thing that we have to do is we have to thank them, we have to reward them, and we have to make them feel appreciated so they have job satisfaction and want to come into work so far as that's possible every day. And if you do that, then you get people who are happy in the workplace, and that in turn comes across to patients who get excellent patient care, but also an element of hospitality care in that as well, that they feel they're in a top hotel as much as they're in a hospital.